Hello everyone, I am Sanskriti, your co-host for the day, and I welcome you all yet again for Symposium 2025. So, for the next speaker, I'm personally very excited because she is our very own and my dear friend. So, any guesses like who she can be? Can I have like good? Exactly, that's the excitement I'm hoping for. So please join me in welcoming Shagun Arya, the head of iThrive Academy and Research Center. Shagun has been a driving force at iThrive, where she made her first mark as an expert functional nutritionist before stepping into her current leadership role. Her academic foundation is equally remarkable. She holds a bachelor's degree from Lady Irwin College, Delhi University, and is a gold medalist in her master's in clinical nutrition and dietetics from SNDT University, Mumbai. With a deep commitment to advancing functional nutrition education, Shagun has dedicated herself to empowering others with knowledge that truly transforms lives, creating new generation of healers who don't just treat symptoms but heal from the root. Today, she'll be taking us beyond Western norms to explore optimal health ranges that fit the Indian body type and genotype. Because when it comes to health, one size definitely doesn't fit all. So let's give her a warm applause as she takes the stage again. Shagun Arya.
Yes, it works. So, hi everyone. If you've not already heard my name thrice throughout the morning, I am Shagun Arya and I'll be taking you beyond the Western norms. So, basically, what we're going to cover today is what is optimal for Indian and our population. So, who here knows what are blood test ranges? Everybody seen blood test reports? Yes? Show of hands? Yeah. So, how many people know that there are two kinds of blood test ranges that we have? One is the conventional range, which I think most of you would be familiar with because these are the ranges that come with us when the lab reports come to us. And these are the values that doctors usually compare our values to, right? Now, if we talk about the conventional range, that is a statistically derived number, which means that labs, what usually they do, first, either they take it from a Western population. So these are derived ranges. These are not based on our population. Otherwise, very few labs do this. But if they do, what they tend to do is that they take a particular population group, locally sourced population group, and they see who all are healthy in that. So apparently healthy. So this means that they're not looking at the inner blood work of people. They're just seeing who is not visibly sick. And those are the people that they're testing. Now, based on that, they get the data. And on that data, they plot a bell curve and they take the middle 95%, which is then called the normal. And that is what the reference range is based on. Okay, which is why I've said that it reflects what is common, but not necessarily what is ideal. Okay, now we compare it to optimal ranges. Who here knows what optimal ranges are? Yes? Functional medicine practitioners? Yes, thank you, thank you. So optimal ranges, if you know what those are, they're usually narrower. Now these are again based on Western populations, but why are they narrower? Because these are values which are associated with, first of all, peak metabolic efficiency, which means that that person that they've selected has good metabolism. Okay, they're also at a low risk of disease and they also depict optimum cellular functioning. So based on that, what we see is the ranges that are used as optimal ranges are what is ideal for performance, longevity, and prevention. And it's not just a statistical normalcy. So optimal ranges, essentially, they define the parameters of good health versus your conventional ranges, they define the parameters of disease. Now here comes the problem, and this is the biggest problem that is there, especially in the conventional world. Many Indians, they get their blood test done, right? They might be symptomatic, which is what actually pushes people to get their test done. But their lab reports might still come back to normal. Because right now, what are we doing? We're plotting it to the 95% of the normal bell curve. Right now, for example, say the population that you've taken, maybe it's vitamin D deficient. Maybe there's a lot of insulin resistance, there's a lot of inflammation in their systems already. So if you take that normal, if you take that as their average, that will still push your limits outside, and that will still be considered as normal according to conventional ranges. So people might be experiencing the symptoms, but still their reports will still continue to say normal. And that's when people can also get diagnosed as something as stress, right? कि आपको कुछ नहीं हो रहा है, आप ठीक हो, ये सब आपके दिमाग में. Okay. Apart from that, again, like I mentioned, many Indian labs, they still take their ranges from Western derived reference intervals, and not just that, even the vendor provided ranges. Now, what does that mean? All the labs have different testing techniques and different machines. Those machines then take out their reference ranges and then they share it with the labs. Again, those are mostly based on the Western population. Now, if we talk about functional medicine ranges, again, they are obviously we've been taking references from the Western practitioners and they have not been validated for Indian genotype. While these are better ranges to use, yes, but are Indians different to the Western people, Caucasians and Indians difference? Yes, we'll talk about the difference also, but this is where the mismatch comes. And what does that mismatch lead to? Three, uh, three problems, okay? First is there's a misdiagnosis. People are feeling the symptoms, right? But they're not getting diagnosed because the blood reports are coming back as normal. Apart from that, overtreatment. Now, this is not talked about often because in the Caucasian population, there are still certain ranges that might be higher or lower. Okay, based on that, we are treating our patients. And there can be overtreatment, oversupplementation. It could be a very bad thing for the body as such. And there is false reassurance as well. Blood test normal hai, you feel okay. Okay, maybe it is in my head. That's what people are telling me. Maybe that's the problem. Yikes. Ui. Yes. And this is not just us saying this. This is what the research papers are saying. So if you see, research papers are quoting that most of the available reference ranges are of the Western population. And these are not suited for our genetics, our lifestyle, and our diet. So you see that there's a gap that is there. Now, since we're talking about reimagining the future of healthcare, of course, we asked AI, what is their perspective about the lab ranges? So the first question that we typed, where did clinical reference ranges on the lab test come from? Now, this is actually fun because this has been established in the previous century, right? So the ranges that we see on the lab reports were essentially originated in the 1940s and 1960s, which should be concerning because it's been a while, right? And at that time, what was done was that, like I said, they took a group of people who appeared healthy. They were not necessarily healthy, they just did not look sick. Again, point of concern, right? Now, who were these healthy people that they originally chose? Mostly they were young because we assume that we are better. Then they were white. That's also an assumption. They were urban, hospital staff and volunteers because it was easier to pick up people from the lobbies and test them. And they were often male. Sad and true. Okay, so they were not represented of different ethnicities. They were not testing on women. They were not testing on the elderly and people with chronic conditions. So the normal range is essentially biased. And the final question was that are these ranges updated? And AI just said barely and very slowly. Now, this is the normal trap that many people fall into. So what we've discussed is the statistical normal. That's the conventional ranges that we've been seeing, right? That captures the mathematical construct of 95% of the tested group, okay? This is not equal to physiological health because physiological health is a value that you get when you actually test on certain ethnicity, certain diets and environment, okay? So even if somebody is having all those symptoms, like maybe fatigue, body pain, dysglycemia, all of that could be happening, right? And still their reports are coming as normal, that's when there's a frustrating symptom gap that comes, okay? So clinical ranges, they will essentially answer, are you sick yet? Whereas functional ranges, they are there to answer if you're trending towards dysfunction. And that is the stage where you want to catch a person at, somebody's health at least, because we're talking about preventive healthcare, right? So that is a stage where you want to look at. Now, I've called this the Indian biological set point because these are the four things that will essentially and primarily dictate what would be our Indian genotype like, right? Rather, our Indian ranges. So the four factors are genetic, dietary, epigenetics, which means the influence of environment on our genetic expression, and metabolism, of course. I'll not get too technical. There are few technical terms, but I'll tell you. Our ancestry and our lineage is very unique and it's a mix. So even in India, we're not one genotype. Okay, there's ANI and there's ASI lineages that we have. So we need testing to happen pan India. Okay. Apart from that, even we have variations in hemoglobin and erythropoiesis, which means we have higher prevalence of beta thalassemia traits, HBE, and G6PD variants. What does that indicate? That our values for RBC, MCV, even RDW, these are all different. Okay, and they cannot be compared to the Caucasian population. Apart from that, even in our metabolism, there are genetic variations. So there are differences in our genes that basically lead us to a higher stage of insulin resistance. So we are more susceptible to it. No wonder we call the diabetes capital of the world, right? Apart from that, even how our body metabolizes fat, even that is different. So all of that combined makes it a genetic predisposition to obesity and diabetes. And vitamin D, do we all know that we're deficient in it? Yes, there is a reason. Okay, so vitamin D receptors, okay, your cells have them. They are basically not that sound in our body, okay, which is why your vitamin D levels and your calcium levels will get affected. And even your drug and nutrient metabolism can get affected because of variations in your CYP450 gene, your MTHFR gene, and your NAT2 genes. Now, basically, these genes are involved in your methylation cycles, even in clearing all the drug excess that is there in your body, helping clear that, and even getting detox done in the body. Okay, so your Western derived normal ranges, they do not align with the Indian genotype. Now, if we talk about epigenetic, okay, first we talk about the gut, all right. Indians are more predisposed to having more inflammation as well, and we do have a different gut. Would you not agree? If you compare it with your NRI cousins, yeah, we clearly digest food better, but our microbiota is not that great because we have more Prevotella and less bacteroidetes, which means it impacts how we absorb nutrients in our body, how much of immune signaling is happening in our gut. There is a gut immune system, right? We're all aware? Yeah. So how much of immune signaling is happening and how much of inflammation is there in the system? Okay. Apart from that, we all know we are chronically exposed to environmental toxins, right? So all the people from Delhi, congratulations to coming to better air, first of all. But we are also exposed to more air pollution, right? Heavy metals, pesticides, all of that, very common in our system. So this basically triggers oxidative stress pathways and really alters how our enzymes function. And we've spoken about sunlight, we've spoken about vitamin D. We are a tropical country, right? Which means that we should be abundant in vitamin D, but that's not the case because we have melanin rich skin. We also have urban lifestyle. How many of you are able, who are corporate employees, who are working in offices, are you able to take out the time and go and expose your body to sun? No, right? Whereas we need it more because melanin rich skins need more exposure to it. Because of that, your cutaneous synthesis combined with the VDR polymorphism, it basically impacts how much vitamin D your body is able to make. And of course, there's a cultural and behavior factors. We like to keep our circadian rhythm disrupted. Night shifts, irregular meals, reduced physical activity, all of that, it combines and leads to more different impact on the body. And there are dietary factors as well. So if we look at the imprints of the Indian plate that is there, first of all, which is that one macronutrient that our diets lack? Protein, right? We are a population that is heavily dependent on carbohydrates, unfortunately, because we need higher quality and better quantity of proteins in the body. So refined grains, inflammatory fats, they just add to the load in the system. Apart from that, Indians are predominantly vegetarian, right? Because of that, there are more deficiencies that we are predisposed to, which includes vitamin B12, folate, iron, all of that. And of course, if there's a higher glycemic load, which means that if you're having a lot of carbohydrate-rich meals, it will lead to postprandial hyperinsulinemia. So your body will have higher blood glucose levels, it will have higher insulin in the body, so which will lead to early insulin resistance. And metabolically speaking, now Indians are known to have the thin fat phenotype. Now this means that we have a higher body fat percentage, and that is concentrated mostly around the abdomen. Okay, now because of that, we have adipocyte signaling, which means that your adipocytes, they start going to your insulin, they start affecting your insulin receptor signaling. And that leads to early insulin resistance and hypoglycemia. Apart from that, they also start to go and attach and attack your liver, because that's where your fat cells will go, right? So because of that, you will end up with more levels of triglycerides and lower levels of HDL cholesterol. I know Saloni has a talk on mitochondrial efficiency, but if you have a lot of fat in the body, even your mitochondria will not function well. Now we recognize this gap, right? We understood that there is a gap that is happening. We've been dealing with clients, we've been trying to work around people's health. That's when we understood all these causes, we understood that there's something that is missing. But in the true iThrivian spirit, we embraced it as a challenge. But it wasn't as easy as it sounds, because this was a challenge, and I'll give you this task. There aren't enough research papers. For Indian population, there just aren't enough papers, and they're not good quality papers, which is why there's a huge gap. But we still went on this challenge about a year back. We've been promising the optimal ranges to our community for a while. We've been working on it, I promise. So at many points during the research, we were at this phase because we didn't know what we were doing, because there was no research, there were no papers, there was no good quality of things that we could look at. So why wasn't this project that we'd taken as simple as it sounds? Now in this, can you tell me in this paper quickly, is it a good paper? If you're looking at liver enzymes? Quickly, I'll get kicked off the stage. Apparently healthy, okay. And keywords, okay. No. Age group, okay. Age group is good, 18 to 60 years. Vast age group is what you're saying, okay. What else? Okay. Akanksha, you can't answer. You worked on this. Okay, I'll tell you. In liver enzymes, if we're testing for it, should we be considering alcohol intake per day? Will it be impacting? Yes or no? Yeah, they considered. That was their healthy group, right? And this was a good paper because they stated the inclusion and exclusion criteria. We could not get papers that were stating it, because apparently healthy is a very common term that's being used in research papers. Okay, so just to give you an example why this project has been taking so long, because we don't have the papers. Give us funding, we'll do our own research. But till then, we are really reliant on other people for the research. But we've made progress. Okay, now conventionally, if I just give this example of HbA1c, conventionally, this is the range. So below 5.7, you're good. Okay, and if you go over 6.5, you're diabetic. Middle range, you're in pre-diabetes, right? But if we look at our optimal ranges, earlier, what was the optimal range? I know students are here. No, not you. You're close. 5 to 5.3, right? Now we've changed it, okay? Because we've been seeing that even if somebody has iron deficiency anemia, or they have hemolytic anemia or sickle cell disease, even that can impact the HbA1c levels, okay? So that was it, guys. Any questions? Yeah, Mike, please.
This is my whole life's premises that James Watt was not born in India. So steam engine was not invented here, and we lost the plot. So whatever science we say, basically it's a Western science. We learn and we try to reach to some level. And now we have reached to that same level that we started questioning them or questioning whatever we have been taught. But tell me what is preventing for even world, forget under the Western world to give us the range, what you are saying that it was ages before the ranges were frozen. With such a great AI tools, millions and millions of blood reports can be analyzed at fraction of second of sick people, of volunteers across the world. Who's stopping this kind of moment to happen?
That's a really good question for world leaders, but I'll still try to answer this because, see, it's not as simple as it sounds. You need populations, right? You need to be able to identify populations. You need to be able to get their consent for testing and all of that. Okay, now, whenever there's a condition that starts coming into the population, for example, like diabetes, right? It started becoming prevalent. We started seeing more ranges. That's why the earlier reports used to be more than 140 used to be the norm. Right now they've reduced it to 126. So as soon as they start seeing a trend in the health that is changing, that is when you understand that, okay, that is when rather they understand that they should be able to now research more and then change the ranges further.
Or is it somebody already has done it in Western country and because there is some business interest, they don't want to make it more
Quite
precise?
possible.
Yeah.
If you want to go into those conspiracy theories, it's quite
No, no,
possible.
business theory. There is no conspiracies.
No.
Business is prime.
But if the big pharma and all of that, if they just want to keep us
No, in any
sick,
era, business will always prevail. Whatever
of
we
course,
scream, shout.
over health. Yeah.
Yeah, I just want to speak on something that sir was asking. Myself, Dr. Mrinal Deshpande. I'm working on diabetes reversal right now, and the ranges, as you were discussing. So initially, it was like the ranges were found out. World Health Organization and American Diabetic Association. These are the main bodies who are actually working on it, and it is more of the reduction science. It's the only thing which has come up from research that has been going on since years. So when it was asked, then why the ranges have suddenly gone down? When I was learning, it was something 126 fasting was okay. Now it has come down to 80 to 100 or 110. So why these is like so? So it's not only about the research and numbers that have come up. What they answer on this when asked is lesser the better is what the answer was, and it was really not uh, based on some uh, great studies that have been done. So yes, I also believe that we should have more number from our side as Indians. We are lacking somewhere on researches, and that should be done is what I feel. Thank you.
So the lesser the better is not what we're going to say. We're going to base our ranges on proper research. Yes.
Hi, Rutambara here. So I have a question in the same line. So since we have been following these Western ranges, and it is wrong for us on so many levels, so definitely we have been treated in a wrong way or somewhere, and those
It's the better of two evils. So there's just one way that they've taken, but we should be optimizing it better.
Yeah.
Yeah.
So, is there any chance that because of these wrong treatments or the side effects of these medications or something, because of that, maybe our genetics has changed or modified in a such a way? Because now we have been, India is becoming capitals for many metabolic disorders.
Yeah.
So, is there any chance that the root is underlying because of these treatments?
It can be, yes, it can be one of the factors. There's also lifestyle that is there. There's also the poor nutrition that we have. So all of that combined, okay, genetics, like we always say, it's like a loaded gun. But your lifestyle and all these things, this is like the trigger for it, right? So of course, it could be the pill popping that we commonly do. That's not a good thing for health ultimately. So that could also be a contributing factor.
Yes, thank you.
Hello.
Any other questions?
Hi.
Yes. So can't see who that is. Yeah, sorry. Yeah.
So because we were talking about diabetes and all of these things, if there's a diabetes that happens to a next generation because of the genes that the family carries, are you able to reverse that also? I mean, I understand the lifestyle changes and everything that takes place in that, but if we are somewhat at par with the lifestyle changes, still would there be more supplementations, or would you work on the lifestyle changes?
There would be more treatments in the sense of maybe we'll see in the world of peptides if we're able to find that, right? So there'll be a little bit of advanced treatments that'll be there, but if there's a genetic risk of it, then of course you don't trigger it more in the child. So you keep on looking at all the holistic ways in which you can kind of just stop it from getting triggered in the offspring.
Got it. Thank you.
So if I can add to that, right? So diabetes is really more of a mitochondrial health dysfunction than true genetics. There would be very few little babies born with actual type 1 diabetes, and that would be diagnosed right at the hospital, because even when they are breastfed, they would have this diabetic ketoaciduria. So that's a completely different problem. But the juvenile diabetes and everything that we're seeing now, everyone wants to blame genes for that, but it is really induced by poor, like the stuff I spoke about. You just get kids to do that, they will not have diabetes. I can like put that on Instagram and not be challenged for it. But like diabetes is a mitochondrial health problem. You fix the mitochondria, it reverses. If it has fully developed, then yes, more interventions, peptide supplements, food, lifestyle changes, but it can be mitigated really, except for pure at birth type 1 diabetes.
Hi, one last question.
Yes.
So as we spoke about, there's lots of difference between Caucasians and Indians, as India is very diverse and there's so many differences regarding the regions where we are from. So should we consider the blood test should be different from different regions, because
Yeah.
hilly areas people will
Yes.
have a different genotype. They have a complete different RBCs than some other people from the lower hill areas.
Yes.
So how should we consider that to be part of?
In an ideal world, we would have ranges for every population group, right? But even if we get ranges for our own country, that's the first step, right? But yes, if we look at every population in our own country, it's different. Okay, so if you go south, you go north.
Organize for like all Indians cannot fit into a single category where
Right.
this is an optimal range for everyone, right?
So we are working on the statistical model. So we're not doing just averages of blood tests right now. Okay, so all the papers that we're getting, we're not averaging them out. We're working on how to make it statistically the best. Okay, so we're able to see what kind of population where it's coming from and how can we make it combined a good range to refer to. Okay, because at this point, it's very difficult for us to be able to find the research and go into population specific areas in our country at least.
Yeah, but considering it all, like
Those are minute differences. Even within our population, it won't be that major.
because some regions the people have more thalassemia traits, some doesn't have.
Agreed. I'm with you that there are population differences for sure, but they won't be as advanced as it is between two different population groups. Okay, but we'll get there.
When a patient comes to you, you're not going to reject them saying, oh, but you're from state and I don't have.
We consider the place, we consider some traits so that we can diagnose it.
So right now, the entire approach of functional medicine also is to go away from what conventional medicine was doing and use the best of the best knowledge that is available to create better patient outcomes.
Yeah.
That is what we will for life continue to attempt to do with as much limited data that keeps coming to us. For now, if it is all of India, still better than using Caucasian ranges. 5 years from now, well, if you get funded in the next 2 months, maybe 3 years from now, we'll have data for all of India. But we work with what we have so that the person who is coming to us seeking help gets something beyond what they've been getting their life, right? So if someone has a thalassemia trait, you can do genetics, you can find that out. Then you don't need to even say, okay, optimal range. You say, this is the thalassemia trait that's there genetically. Now I'm going to optimize for that using better iron, better cofactors and all of that. So we do best with whatever knowledge we have. Otherwise, we would have already gone to the top of the pyramid that I showed early in the morning.
Thank you.
So thank you, Shagun, for taking us through the vision that India deserves its own definition of optimal health.